Hi, my name's Sian and I'm a neurodevelopmental nurse specialist at Autism Oxford UK, and this month is Cervical Cancer Awareness Month. So I thought I would take some time to dispel some myths about the cervical screening programme. One thing I hear a lot is that this is a test for cancer, or this test is going to tell me if I have cancer or not. So this is absolutely not true. The cervical screening programme is not a test for cancer, but it is one of the most effective ways at catching cervical changes before they turn into cancer. So the test actually tests for a group of viruses called the HPV virus or the human papilloma virus. Almost all of us will contract a form of HPV at any time in our lives, and you can still contract HPV if you haven't had penetrative sex. So it's really, really important that you go for your cervical screening. The screening will also detect any cell changes caused by HPV, which can lead to cancer later on. Another thing I hear quite frequently is I've had my cervical cancer jab, so why do I need to have my cervical screening done? This is because there are lots of different forms of HPV virus. The cervical cancer jab aims to protect against lots of the high risk types, but it doesn't cover all types, unfortunately. And if you have had sexual intercourse before you've had your jab, you are still at risk. So it's really important that you still have your screening, even if you've had your jab. Another one I hear is I'm in a long-term committed relationship, so I don't need my screening. What we know about HPV is it can lie dormant in the body for a very long time. So it doesn't mean if you test positive for HPV that you've contracted it from your current partner. It may be previous partners, be those male partners, female partners, or non-binary partners, or trans partners. You can contract it from anybody. So it's still really important to get your cervical screenings done. Lastly, I hear a lot that I've had a hysterectomy, so I don't need my cervical screening. Now, this can be true, but it depends on what type of hysterectomy you've had. If you've had a full or a radical hysterectomy and they've removed the whole of your cervix, then absolutely, you no longer have a cervix, so you don't need to have this screened because there'd be nothing to look at. But if you've had a partial hysterectomy, or they've left part of your cervix in place or the whole of your cervix in place, you still very much need your cervical screening, because you can still contract HPV and still get cervical cell changes which can lead to cervical cancer. If you have any more questions about your cervical screening, then we at Autism Oxford have lots of experience discussing this. We have nurses on our team and also people who've gone through the process themselves. So please get in contact if you do have any more questions.